Good day, ladies and gentlemen. Bonjour, mesdames et messieurs. Welcome and thank you all for joining us for today's World Malaria Day Virtual Roundtable hosted by the African Leaders Malaria Alliance. My name is Eunice Eleanor Klinogo. I am the Vice Chairperson of the ALMA Youth Advisory Council. Today, I'll be having a conversation with an amazing panel on the role of young people in harnessing real-time data to scale up and optimize tools for malaria elimination. And before we move into that substantive discussion, I would like to share few housekeeping information. This webinar is available in French interpretation in Zoom. Pour les francophones, vous pouvez avoir accès au service d'interprétation sur Zoom en sélectionnant la chaîne française, en cliquant sur le bouton interprétation sur votre fenêtre Zoom. Merci. And secondly, if you are here as an observer or as a member of the audience, you can use a question and answer feature to share your questions or comments. Kindly keep your questions very clear and precise. We would also like to get social, so please do follow us and tag us on all social media pages. Thank you very much. I'd now like to welcome the Executive Secretary of the African Leaders Malaria Alliance to give her opening remarks. Ms. Joy, you're welcome, and the floor is yours.
Thank you so much, Eunice. I hope you can see me.
Yes, Ms. Joy, we can see you.
Okay. Thank you so much, and it's a pleasure to be here. Young leaders and change makers, ladies and gentlemen from Africa and the diaspora, I welcome you all to this virtual youth roundtable to mark this year's World Malaria Day 2022 under the theme Advance Equity, Build Resilience, and End Malaria. ALMA is today highlighting the importance of keeping malaria high on the global agenda. We recognize the importance of active leadership, activism, and involvement of young people in the journey towards malaria elimination. You, the young people, are in the vanguard of the Africa we want. Today, the global malaria burden continues to be high despite our efforts. It is higher than previously estimated, and half the world's population is still at risk of the disease. Unfortunately, countries with the highest burden of malaria, which are mostly in Africa, have the least ability to fund health services and have suffered the greatest economic impact from COVID-19 and will be further burdened by the current global inflation. As young people, you are the hope for Africa's social, economic, and political transformation. Constituting over 70% of Africa's population, you have a special role to play in directing Africa to realize the ambitious and bold agenda to achieve the vision of a malaria-free continent by 2030. Upon assuming the chairmanship of the African Leaders Malaria Alliance, His Excellency, President Uhuru Kenyatta outlined a catalytic 4-point agenda that included the creation of the malaria youth armies in countries, working with you, the young people, existing youth leaders across the continent and in the diaspora to champion youth engagement and resource mobilization, and holding countries and partners accountable for commitments that we have made to Africa's people for malaria elimination. The Malaria Youth Army is promoting innovation, it is promoting research and development, and building a cadre of malaria advocates and champions in the fight against malaria. In July 2021, the ALMA chair kickstarted the process with the launch of the Kenya Malaria Youth Army. which has seen young people engaged in creative advocacy campaigns at country level to support the ongoing efforts of malaria elimination. This year, ALMA looks forward to supporting national malaria youth army launches in other countries, such as the Kingdom of Eswatini, such as Zambia, and others, which will provide more opportunities for young people, young leaders to tap into the existing efforts of malaria elimination, both at country level and continentally, concentrating on where the present gaps are and how they can be bridged. I call upon you, youth leaders, to claim your space, harness your skills, your energy, your creativity, your innovation, your drive, and your can-do attitude to effectively support malaria prevention and control efforts at community level while the disease is wreaking havoc in our communities. Further, as the world unites to advocate for the funding of malaria programs through the Global Fund, youth voices are more critical than ever. I urge you to raise your voices to see that the 18 billion ask under the 7th Global Fund replenishment cycle is fulfilled. A successful replenishment will see millions more lives, particularly in Africa, where the endemic countries are saved through the continued delivery of life-saving commodities and innovations to tackle emerging challenges in the fight against malaria, such as the impact of climate change and resistance. Together, we can win the war against this dreadful disease. I wish you a productive session, and please always remember that zero malaria starts with me, but zero malaria starts with you, the youth. And zero malaria starts with all of us. Thank you.
Thank you very much, Ms. Joy. Those are very, very powerful words. Together, we can win the fight against malaria. Those are words that we will reflect on throughout this discussion and beyond the discussion. So thank you very much once again, Ms. Joy. I'll now like to invite the chairperson of the ALMA Youth Advisory Council, Mr. Alois Urasa, to give us his opening remarks. Mr. Alois.
Thank you very much. Thank you very much, Eunice, for this opportunity. And thanks very much, Ms. Joy Pumafi, for the great opening remarks. Your Excellency, Ms. Joy Pumafi, ALMA Executive Secretary, Excellency Ambassador Anton Okara, ALMA staffs, IAC leads and members, honorable speakers, distinguished guests, and all participants of this important webinar, greetings from ALMA Youth Advisory Council. I am delighted to welcome you in this paramount discussion towards commemoration of World Malaria Day this year, 2022, marked by a theme, Advance Equity, Build Resilience, and End Malaria. And our focus area of discussion geared towards the role of young people on harnessing real-time data to scale up and optimize tools for malaria elimination in Africa. After decades on the fight against malaria, Africa, particularly Sub-Saharan Africa, remains a home to over 90% of malaria burden, where a child under the age of 5 years dies in every minute. This is unacceptable. COVID-19 has even jeopardized the efforts with 12% increase in malaria deaths in 2020 as compared to 2019. It is imperative that young people who compose to over 60% of Africa population to understand the trend and be able to utilize the data and be creative and innovative enough to come up with critical solutions to reimagine a future of Africa without malaria, Africa without maternal deaths, Africa without under 5 high mortality rates, Africa without poverty, health, vicious cycle, Africa with a health population. Young people in Africa have great potentials which are still untapped: innovations, communication for change, creativity, leadership, community action, and many more. Thanks to stakeholders, individuals, and organizations like ALMA who believes in youth leadership and continuously offering support to youth in Africa to unleash their potentials. In the past year, about 3,000 young people from 38 African countries have been recruited as malaria and UHC champions, and now in progress to form country youth armies to champion for what counts in their country health systems. We also trained over 120 youth innovators for malaria elimination, use of scorecards, and other relevant topics such as problem solving, system thinking, resource mobilization, and health communications with support from African Union Youth Program, Waki Health, and many other stakeholders. We look forward to doing more to ensure meaningful youth participation towards malaria elimination in Africa. Today, I call on young people to believe in their potentials and leadership and to do what they can to ensure better health for all. I further call on global leaders to strongly invest in the Global Fund replenishment, which is critical to drive us towards zero malaria. I call on the CSOs, international organizations, NGOs, faith-based organizations to invest in youth leadership so as we can truly achieve the Africa we want, Agenda 2063, universal health coverage, and the SDGs 2030. It is truly that zero malaria starts with me, but zero malaria starts with everyone, starts with you, and starts with us. Again, welcome, let's reason together to end malaria. Thank you very much. Merci beaucoup, asanteni sana.
Merci beaucoup. Merci beaucoup, Alois. Merci beaucoup pour votre introduction. Merci beaucoup. We have heard from our executive secretary. We have also heard from the chair of the ALMA Youth Advisory Council. I believe it's now time to hear from our panelists. I would like to quickly turn over to our panelists and starting with Dr. Donald Appart, who is the program manager at the Global Fund Malaria Project at AMREF Health in Kenya. So Dr. Donald Appart, this year's, the theme for this year's World Malaria Day reinforces investment and reinforces how investment in ending malaria saves lives and also is vital to achieving a safer world. And the Global Fund continues to make several investments and continues to support countries to deploy innovative and more effective vector control initiatives. I'd like to get your reflections on how we can integrate young people in the workings of the Global Fund, as young people as change agents in the workings of the Global Fund, and also to find out from your point of view, how best can we position young people to be effective, to do effective and impactful advocacy of the tools for community ownership and awareness. Dr. Donald.
Thank you, Eunice. I hope you can hear me well.
Loud and clear, Dr. Donald.
Yes, thank you very much. I'm Dr. Donald Appart from AMREF Health Africa, a principal recipient for the Global Fund Malaria Grant. And thank you. So I'll start from basics because we all understand that the fight against malaria requires everyone, the youths, the children, the adults, the elderly, and everyone else. But if you look at the history of malaria interventions across the world globally, there's been a lot of focus on children under 5 and pregnant women per se. And the other populations basically have benefited from interventions that probably are not as robust as what has been basically been provided in the other population. So that is one critical thing. Secondly, is that it's also good to understand that there's a lot of evidence that now it's suggesting that the youths are actually bearing the highest burden of this disease. If you look at most of the recent malaria indicator surveys for Kenya, for instance, recently conducted, then we start to see that the prevalence of malaria actually increases with age. And we are moving away from the traditional sense where, of course, we knew very well that children under 5s will be the most affected by malaria, but because of the interventions that are currently in place, if you look at the use of the malaria vaccine that is actually coming in, it focuses more on children under 5. If you look at some of the mass drug administration strategies that are being used, mostly targeting children. If you look at IPTPI, IPTP in pregnancy, and so forth and so on. So that is one particular area which basically demonstrates that there's enough evidence that actually the young people, especially above and over 5, are actually being left in the war against malaria. Secondly, evidence, again, we have women of reproductive age. We all know that of course, a lot of work has been done in terms of building the capacities, social behavior change, and so forth and so on. Again, we are seeing that even now, mostly pregnant women are getting pregnant when they already are having parasites within the system. And those are evidence that actually bring to the attention of the global malaria fight that we actually need to start broadening in terms of our thinking and so forth and so on. So Africa generally has the highest population of youths. I believe it's over 70% of the population of Africa is basically youths, and we cannot start avoiding, we cannot continue avoiding these populations. Different strategies are being proposed. Some have been tested before in terms of how we can use the youths in terms of being the change agents for malaria. And if you look at the fund approach in terms of what they do in terms of supporting malaria in countries, that approach is on education. And why is education critical? If you look at the current tools for malaria control and elimination generally, that's tools that are actually being developed against the parasite, the vector, and of course, this operating within an environment. You can see that the uptake of all these interventions depends on the human behavior. And the human behavior basically is embedded within our education levels, the youths. I mean, when we start your development from childhood into adulthood and so forth and so on, if you don't have the basic education in terms of what needs to be done when you experience such a case, it becomes very critical. And that is one of the gaps that we've actually experienced in terms of the fight against malaria. Secondly, and education, of course, is a cross-cutting issue. And you can see that currently most of the pilot implementations, and it's actually very sad that a lot of work has been done in malaria, but when it comes to innovative approaches, mostly they're done at pilot stages. And then the scale up of these interventions becomes very difficult because of the little investments that are provided in terms of these interventions. First, we are having now school health programs, which are one of the interventions that have been used. I've looked at a lot of literature in Ghana, in Rwanda, in Kenya, and so forth and so on. And you see that schools have been used as an entity for introducing knowledge around malaria prevention, control, and treatment, and so forth and so on. Currently, we are seeing governments actually now having malaria prevention lessons as part of the curricula. And this is one particular area that now we need to start investing in so that as our kids grow, then they already have the knowledge, because that knowledge is what basically at the end of the day determines your attitudes and your practices. Secondly, we have other fora, strategies that have been used, and I want to really talk about the community health worker system, community health programs. This is a system that has been there. Evidence is showing that community health workers actually contribute to the reduction in morbidity and mortality because they're the first point of care. Governments are now actually adopting community systems, and this is an opportunity for youth to participate. If you look at the workforce of especially the community health programs, you'll see that most of them will be youths. Of course, there's always a mix in terms of the ages, but this is also an entry point where we can actually use our youths in terms of introducing them and as they graduate within the system, they're able to basically have an opportunity to sensitize the populations around them and so forth and so on. Thirdly, the various opportunities at the community levels, community system strengthening, even as AMREF through Global Fund support, we are looking at issues around key populations, vulnerability in terms of access to some of these malaria interventions. How do we use this opportunity to basically ensure that each and every person is reached? Like I said from the beginning, we contribute, youth contributes to the majority of the population. So basically everywhere you're going to get a youth, but how do we utilize them in terms of how a very powerful tool in the 21st century, that is the social media, where we are able to communicate to a vast array of people. And this is also an opportunity where we can actually have
it's briefly disconnected.
Yes, sorry. Is there a question? Someone talking from? Oh, sorry about that. So I was talking about the social media, and these are platforms that we can actually utilize in terms of communicating in some of these malaria interventions and so forth and so on. Into my last response to the questions actually you've asked around how the youth can actually play based on the investments that are being done. I know Global Fund has actually developed, announced the Youth Council, which basically brings youth into play so that they'll be able to share experiences and actually use these opportunities to leverage some of these interventions into the systems, the broader health systems. And these youth councils, I believe, are also mimicking what ALMA is also having, the Malaria Youth Army. And us in programming, we feel like this is an opportunity to be able to support the youths. Of course, we are seeing a lot of innovations around the use of drones for malaria control. This is something that we are already seeing in Kenya in terms of sprayings and so on. We are encouraging youth to get into research and development, so able to participate and actually understand the ideas in terms of what needs to be done towards elimination. We are still far as sub-Saharan Africa. Of course, we hope we are still in the control phase. Elimination is slightly away from us, but it's only us who can bring it closer by actually involving every person. Thank you very much.
Thank you very much, Dr. Pat, for those reflections, and congratulations to the Global Fund for establishing the Youth Advisory Council for the Global Fund. And your reflections lead me straight to the next speaker, who is Madame Vivian Joseph, who is the Cluster Health Leader at the South African Youth Forum. She's also a medical student. Madame Vivian, you're welcome.
Good afternoon.
Good afternoon. Dr. Apat just mentioned how the potential of young people, and also mentioned how the Global Fund has established a Youth Advisory Council. Across the world, we see that there's the young people are coming together in a broader movement to end malaria. And we know the South Africa Youth Forum does a lot of work in supporting young people or in undertaking interventions to end malaria. But I would like to hear from you on what is your take on ensuring that they are more impactful, the movements are more impactful, and these movements are driven by data and research.
Okay. First of all, I'd like to give my appreciation for the invite to your panelists in this great session and webinar. Thanks to everyone that has participated to make this possible. Well, let me just go direct to answering the questions that have been forwarded to me, so to save time. Well, you've asked, and one thing I can say as a health cluster from the Southern African Youth Forum, the health cluster, is that one thing that we have to realize in Africa, we have won since we're having a lot of young people realize malaria is a problem with society, and it is robbing opportunities that.
Hello, Vivian. We are having difficulties in hearing you. I think there's a glitch in your connection. Hello, Vivian. If you can hear me, there's a glitch in your connection. I don't know if you can reposition yourself well, because we are having difficulties in hearing you.
Can you hear me right now?
Okay, it's better now. You have the floor.
Better?
Yes, it's better.
Okay, thank you. Thank you. So I'll proceed. As I said, one thing that Africa has won is having a lot. We have realized as young people that malaria has robbed our future. Malaria has robbed a lot of opportunities to realize our dreams. But then it's also true that a lot of young people have awakened into fighting against malaria, so that with a sense of belief that it is going to be eliminated in a lifetime. And since young people are ready to volunteer and supporting malaria control efforts, I think there's a need to increase capacity building for young people and into bringing in talents, bringing more creativeness, to bring more utilization of sense of innovation, and so as to have a better use of technology into control and eliminating this disease. And also, there's a need of having meaningful inclusion of youth in malaria leadership, research, development, policymaking, and advocacy. In many African countries, there's a lot of data. We can see for ourselves that a lot of data is being collected, that maybe there are these statistics of malaria in so many different regions, but then the question is, how is this data being used in eliminating this disease? And also there's a need to increase funding in youth-led investments so that youth can make this work easy for them to implement youth-led solutions. So I think those are the three things I could answer to this question, so as we can combat malaria and eliminate it fully. And as my fellow speakers that have proceeded say that zero malaria starts with me. So I think I can end with that for this question.
Thank you very much, Vivian. I just want to tap into what you just said about the interventions and the strategies. I know the Youth Forum, the South Africa Youth Forum, is doing amazing work at the south of Africa. I just want you to highlight a few of the interventions that you have undertaken to tackle malaria.
Okay, so basically, as the Southern Africa Youth Forum, we, the health cluster, we have so far used our voices to engage, empower, support youth communities and young leaders, including the youth with disabilities, to achieve a free malaria generation. By 2030, we believe that with our advocacy, with our engagements as youth and raising our voices, we have so far done a big step. And also we are supporting empowerment of malaria disease advocates. And so far we have had several meetings with policymakers in parliamentary caucuses. We have also sat with the Tanzanian Pharmaceutical Students Association, and we have made quite impactful meetings that we have seen so far so good. We at the Southern African Youth Forum Health Cluster, we have done good. So that's all I could talk about in the engagements we have done and interventions as the SADC.
Indeed, that's amazing work that you are doing as a youth forum. Thank you so much for highlighting those interventions. And this leads me to our next speaker, who is in the person of, thank you very much, Vivian, who is in the person of the Chief Executive Officer of the Kenya National Youth Council. We know that Kenya is making progressive gains in eliminating malaria using digital tools such as the scorecard. And I would just like to hear from the Chief Executive Officer, Mr. Roy Sasaka Telewa, on how, on his perspective in how these digital tools are advancing malaria elimination.
Thank you, Eunice. I'll step in for my boss, Mr. Roy Sasaka Telewa. He's not able to join us and sends his utmost regret, but he's just been called into a meeting by his boss to represent him. So there are things that he cannot avoid. My name is Veridiana Wasike, and I'm in charge of partnership and resource mobilization at the National Youth Council. Now, forgive my attire in the meeting, but we were having a cultural day today, and we were just celebrating diversity and the beauty of our culture. And this quickly jumps me into the conversation we are having about malaria. And seeing how not only the diversity can actually really help us to do that. And that is where you speak towards, if you don't engage with the community, then it will seem as if you're not doing it. And as you have mentioned, the fact that Kenya is using digital tools, for instance, the school kit. And these are critical elements that we need to tap in, especially when you look at Kenya, the advancement of technology in Kenya, technology uptake in Kenya, and availability of connectivity in Kenya is really good. And I believe that is one of the critical elements that is really driving a lot of the engagement that we are seeing. However, one of the critical questions is how vested in this process is the young person. And this is also the other biggest aspect. And I'll take the example of just the recent fuel shortage. In Kenya, you clearly saw there was a quick app that showed you, here is where you can get fuel if you don't find it in the station, if you don't find it in the station. And there was a lot of updates and information going in and guys getting real-time information on the things that where they can get this fuel. And just looking at the agility and how that space can help to transform the advocacy and really driving the conversation on zero malaria starts with me really is the very essence of how to tap into, especially when we are driving young people to really move from to help us get the policies out of just the document into action. And why do we say this? It's also imperative to really have the young people understand what these policies are saying and now transition that into action. The feel is the fact that a lot of, or most of the young people in the preparations of these policies or in the advocacy, in the sensitization, remains more of an inaccessible document in the sense that more or less, how do I put it? More or less, it's not palatable to how they want to consume it. And that's why we use several tools, again, coming back into technology, to put it in probably some pictures, to put it in some ways to present it and have the young people really drive this. So looking, and especially looking through how we can harness the powerhouse of technology to really promote health access for all and also just eradication of malaria is one of the critical tools that we can apply in that. And then finally, I would just like to say the fact that leadership commitment has actually been put in, and especially within the Kenyan context, the president himself launched the Kenya Malaria Youth Army. And usually when we have such high stakeholder commitment, it's good for the youth to leverage on that leadership commitment and really deep dive and drive with that. So even as we have this conversation, and I have also seen within the chat some people saying it's 4 months and we haven't done this and that. It's really all of us to come together with small elements and push forward. And when it comes to online, when it comes to social media, so long as we are within the parameters, so long as we are within what is supposed to be communicated, then we are able to drive the zero malaria agenda. So it is for us to just take the opportunity and do it. We will never have the full budget or the full amount that we need to drive the advocacy or the sensitization, but really we can be able to do this collectively when we do it in our small ways. So leaving us with the quote, the Swahili quote, kidogo kidogo ujaza kibaba, which means we have to really work together with our small contributions every time, and we will really see the end of malaria. And again, it starts with me it starts with me doing that. So even as we are on this call, as we are on this webinar, it starts with each one of us just making that small effort to get it done. Thank you.
Thank you very much. I believe there's a saying that says little drops of water makes a mighty ocean. So if we all bring in our efforts, or we all put in our efforts and our abilities, we'll be able to achieve our aim. Thank you very much once again, and thank you for representing the CEO of the National Youth Council, Kenya. Before I move to the final speaker, I just wanted to make a very little input. So this World Malaria Day, which is Monday, several countries would be launching their Malaria Youth Army, which is really a very big step in meaningfully engaging young people in the fight against malaria. And I see in the comments, I see a comment from our executive secretary on helping the Nigeria Youth Army also launch helping Nigeria also launch their youth army. So this is really a big step in meaningfully engaging young people. And this goes to show how ALMA works with young people to end malaria. So thank you very much, Ms. Joy, our executive secretary. I would like to move to our final speaker, who is in the person of Madame Yassine Jibo, the founder of Speak Up Africa. She currently serves as the co-chair of the Strategic Communications Partner Committee for the RBM Partnership to End Malaria. Madame Jibo, you're welcome. Madame Jibo, one key finding in the World Malaria Report 2021 shows that the malaria cases and deaths were as a result of the plateaued funding and under prioritization of the disease. And Speak Up Africa is leading the March to Kigali campaign to call on leaders and to call on the world to pledge and prioritize the control and elimination of malaria and other neglected tropical diseases. I'd like you to elaborate more on this campaign, and also to share your thoughts on how young people can be meaningfully engaged to advocate to end malaria and achieve better health for all.
Thank you very much, and good afternoon, greetings to all. I would like to start by thanking ALMA and the Advisory Youth Council for this invitation. It's truly inspiring to hear from youth leaders and see the commitment that there is across the continent. From a Speak Up Africa perspective, I think we really value an inclusive, multi-sectoral response in order to control, eliminate, and ultimately eradicate malaria and neglected tropical diseases. And we feel that it's very important to have an effective, integrated, and multi-sector action towards the global agenda to end malaria and NTDs. And youth is really critical to this effort. And we believe that today's youth is the generation that can end both malaria and neglected tropical diseases. And it really is critical for all partners to invest in young people because they are crucial change agents. Youth must be included at all decision-making levels to advise on not only the development, but the design, the delivery, and the implementation of tools and programs that target the health issues that affect them. If we exclude youth, particularly when making decisions about their health, we continue to delay the realization of our objectives to end malaria and NTDs. Both the Zero Malaria Starts With Me campaign and the No to NTD campaign has as a mission to engage all sectors of society, from political leaders who control both budgets and policy decisions, private sector companies who benefit from having both a malaria and NTD-free workforce, but most importantly, communities, including youth that are affected by these diseases, whose buy-in and ownership is critical to success. We know that if we're united, we can drive more action, more innovation, more funding, and more leadership. And last year, the RBM Partnership to End Malaria conducted a survey that really showcased the passion that the youth has across the continent in ending malaria. And I'm sure many of you are aware of these findings, but just to remind you, 70% of the African youth that was surveyed believes that malaria can be eliminated in their countries. And 62% of these youth groups would encourage their governments to do more in fighting these diseases if they knew how to. So it's really critical for us to be able to work with youth leaders, to be able to provide them with the training, with the tools that they need to be able to do that. Finally, I think youth groups are really plugged into community networks, school groups, youth groups, and really using social media platforms. And these specific characteristics mean that they have the potential to be some of the most responsive and reactive members of society when it comes to harnessing real-time data. So we believe that youth can play a critical role in spreading awareness at the community level based on the messages that they derive from real-time data collection systems, but also normalize the use of malaria and NTD prevention tools and methods. And for us, this was really one of the big reasons that led us to launch the March to Kigali Summit on the eve of the Commonwealth Heads of Government meeting in Kigali that's happening in June this year, and really to be able to bring together civil society organizations across the continent to foster an integrated approach to advocating for the elimination of malaria and NTDs. And so we really invite all of you to join this March to Kigali so that we can ensure that decision makers at national, subnational, and regional levels are prioritizing the end of malaria and NTDs, and that we're able to work together to be able to get to our objective of ending malaria and NTDs. Thank you.
Thank you very much, Madam Jibo. And thank you for highlighting the role of young people and how we can be meaningfully engaged to end malaria. And we cannot wait to join you in the march to Kigali. Thank you very much, Madam Jibo. We've heard from all our speakers, and I believe our audience or the observers are very eager to ask some questions. I already see a lot of questions in the Q&A box. I would like to hand over to Ms. Paul to share with us some of the questions that are coming in.
Thank you so much, Eunice, and good afternoon, everyone. It's been a really nice session hearing from everyone. Since most of the questions have already been responded, I think maybe we can have some few questions that can be directed to specific speakers. For instance, we have a question on a lot of young people asking how can they join to be part of the Malaria Youth Army in Nigeria or in Malawi. So maybe that can go directly to the IAC chair, while some of the questions will be directed to the other speakers as we proceed.
Thank you very much, Patrida, for that question. Do we still have the chair of the ALMA Youth Advisory Council with us? Okay, we do.
Yes, thank you very much. And thanks for the questions and the energy that is really coming from the young people concerning the malaria youth armies. Thanks for the questions that are coming out from the young people concerning joining malaria youth armies. The process of joining Malaria Youth Army was done through a call for application for young people to sign up their interest to joining Malaria Youth Armies. And we already completed the selection for the first cohort of Malaria Youth Armies in different countries. However, we encourage young people coming from different organizations or local organizations in the countries to liaise with the Malaria Youth Armies in their countries through our Youth Advisory Council, to partner with them into bringing up activities that will make the Malaria Youth Armies more vibrant at country level. So feel free to reach us through the IAC at alma23.org email, and we'll be happy to respond to your queries concerning joining the Malaria Youth Army. But also you can join us and chat with us through our social media from Twitter, Instagram, and other social media to reach, to discuss about your interests or ideas to working with the youth armies at country level. Thank you. I hope I've answered the question.
Thank you very much, Chairperson. I believe you have responded to the question. And also to add up to what you said, ALMA hosts a lot of youth-friendly projects. And if you would like to be involved in these projects, you can follow and keep yourself updated by following the social media pages or the website. Thank you very much.
Thank you.
We would quickly like to take some more questions from young people, questions directed to our panelists in relation to what they have just shared with us. So I see a question from, okay, I think our chairperson just responded to that question. Please feel free to share your questions in the Q&A feature. And then we read them out. So in the chat box, I see our speakers have shared links to their websites and links to some of their projects. So you can follow or join the March to Kigali and sign the call to action by following the link shared by Madame Djibu. You can also learn more about the ALMA Youth work by following the link shared by Thomas on the Scorecard Hub.
Sorry, Eunice, can I come in again?
Yes, Chairperson.
Yeah, but also for one to become a malaria champion, doesn't necessarily require one to fully or be officially entered into the youth armies, but also one can go through the resources we have on the Squawkat Hub website. It is already shared by Petrida on the questions that was asked by Mark, that you can become by going through the online training available and receive certification, where one can link with the youth armies in their countries and propose some activities. And we are really open to new ideas from young people, especially reaching out more youth, and not only in the urban areas, but also in the rural areas, as this was also raised by one of our colleagues, I think that was Joshua, that we need also to do physical approaches to ensure that we really reach the rural youth. So going through these trainings will equip more young people with up-to-date data on malaria, especially from the scorecard, but also from other sources of data, so that they can also think of ideas that they can bring into the youth armies to accelerate the efforts of youth engagement in malaria in Africa. Thank you.
Thank you very much, Alois. I would now like to call on Melanie, ALMA's Chief Technical Advisor, to respond to some of the questions in the chat feature.
Oh,
Melanie,
thank you very much. I hope everyone is well. Just to say that one of the things we're doing from the ALMA Secretariat is we're working to introduce the youth champions to each of the malaria control program managers in Africa. So we're having a series of calls, planning a series of calls with each of the malaria control programs so that they are introduced to the youth champions and then become part of the formal coordination process in terms of implementing, helping to implement national strategic plans, knowing when is World Malaria Day and what's being celebrated, how the youth can engage, how youth can engage in the existing strategies, and how youth can also help to shape their future strategies as well. So hopefully that will also answer some of the concerns that have been raised in the chat by having that formal introduction with each of the malaria control or elimination programs in Africa.
thank you very much, Melanie. Okay, I think most of the questions all the questions have been answered. So I would like us to quickly move to the next session. But before that, I would like to thank all our panelists for sharing with us their reflections, for sharing with us their perspective on the theme of this year's World Malaria Day. Thank you so much for investing your time with us today. So I'll quickly like to move to the next session and turn to our young leaders that are working in the fight against malaria. I'd like to begin by calling our first speaker in the person of Brian Jeter, who is a colleague at AYAC and also serves as the co-founder for Mati Babu, a kit used to diagnose malaria. Brian?
Thank you very much, Eunice. Yeah, thank you for the introduction and all protocol observed. So to me, I think I will dive in more about my experience, but also the recommendation that I can set up to the youth as they develop solutions towards malaria and towards combating malaria as a disease. So one of the things that they have to really look out for as youth is being investment ready. And what do I mean by being investment ready? So we have to invest more in capacity building, and that is capacity building through educational services, but also peer-to-peer kind of scaling, because most of the youth have had the opportunity of going to school. Some of them are skilled in the different sets, and we have to be able to pass on this knowledge to the fellow youth, and through structures like the youth armies, this can definitely be achieved. So we have to be able to pass on this knowledge to the fellow youth so that they can also be able to advocate for better practices in communities, but also learn and see other solutions that they can bring on board. Maybe also when you talk about investment, we need, I think, from the other different stakeholders that are involved. Also, we are happy to hear the 18 billion grant that is coming in towards the work around malaria, because we realized during COVID-19 that there was the pandemic, there was a decrease in the funding that was going towards malaria. But a lot more has to be put towards R&D, and not only funding, but also the efforts and the time of the youth. It has to be geared towards research and development. And this is in a bid to seek innovative solutions for problems, but also problems starting from community level. And we have to be able to target usable solutions. Most of the times, people are jumping onto buzzwords like data-driven, AI-enabled, and they're not putting in a lot of time to go and understand the fundamentals of these terminologies or the fundamentals of these technologies. For the youth, should look at technology as an enabler. And that means that not in every solution that you're trying to develop for the community has to be a mobile phone application or has to be an app that has to do this and this. We have to also be able to target communities and see what is actually usable. Let's use the data that is coming out from these communities. For example, in some of the work that I've been involved in doing malaria surveillance, we found out that at community levels, not everyone, not every health person has a phone to be able to send all these cases about malaria. So you have to be able to know which kind of funds do they have in these kind of communities, which kind of solution am I gearing up for these communities, and what is actually usable. Is it an app or is it going to be an SMS-based solution? So in this case, we ended up integrating SMSs, for example, to see that data is coming from the health facility to the district health commissions and to enable seamless reporting, but also making decisions at the point of care, but based on SMSs and supporting the health infrastructure in that way. So we have to really investigate what are the viable solutions for the problems at the community level. But also I think a lot of investment has to go into infrastructure. And by infrastructure, that's the different partners and different stakeholders as well. Support the youth in setting up infrastructure at the community level, and at the unit level being the health facility, so that we can accelerate adoption of this technology or the innovative ideas that the youth may be thinking about. And this starts from things like the internet access, enabling that internet access at these health facilities, are trying to go into public-private partnerships with telecoms to see that health facilities have channels of disseminating data at a limited cost, but also seeing that there is hardware at the point of care, and this will help improve the adoption. And I mean, we can look at the different case studies that have been and learn from the different communities that have integrated this. For example, during the Obamacare Act, we saw that a lot of in the US, for example, health facilities were equipped with computers and other gears, and this helped adapt technology to that level. And in that way, we are offering better diagnostics probably to the people, so they are able to know their malaria their malaria status, and they're able to seek medication at any one time. But to the youth directly as well, we need to look at collaboration at a broader scale. So we need to collaborate beyond borders, because we need to think globally, but also begin acting at a local state. So we need to create multidisciplinary collaborations between people of different disciplines as we're creating all these interventions and solutions. We need to also look at collaboration between us, the youth, but also between other stakeholders, the players, the government, other civil society organizations like NGOs, LNGOs that have the mandate to achieve some of these targets, like reducing malaria distribution of mosquito nets, the residual spraying and things like that, and then bring in our knowledge of social media and other kind of technologies to see that we make the implementation work easy. So even at the youth armies at community level or country level, these are some of the solutions that we can really brainstorm on and see that how can we support the civil society organizations within our communities to see that they reach their goal and be able to track their indicators on what some of the impact they want to create in the community. So I think finally, as we work on solutions as youth, and also from the experience that I've gained with the team I work with in deploying a non-invasive malaria diagnostic kit, but also digital surveillance, we have to look at solutions that we develop at an ecosystem level. So it's not a one solution fit all, but you really have to follow the data and understand what role do I play to enable other people build on top of my work so that we can see the change. So do not think about the solutions from this big kind of telescope, but be very minute and try to understand your community and use the data that is coming out from your community and create solutions that are quickly scalable in a way that allows other people to build onto your work and deploy the same kind of models in other communities to help combat diseases. So In a nutshell, those are some of my recommendations. And I think, like the previous speaker said, the Swahili quote of Chidogodogo, taking one step at a time. We need to not be on a lookout of making things happen in a rush, but be able to appreciate time and be able to appreciate the kind of infrastructure that we have in our communities, in our countries, and find innovative ways of circumventing around those obstacles and see that we create bridges, but not only burn those bridges, create sustainable bridges for the solutions for us and for the people after us. Thank you very much.
Thank you so much, Brian. Be able to appreciate time and understand the technology that we use and not just use these big terminologies. Thank you so much, Brian, for sharing those recommendations with us. I would like to move on to the next speaker in the person of Otina Matafi, who is a member of the Malaria Youth Army Champion Zimbabwe. If she's with us, you have the floor, Madam Otina.
Thank you so much. Okay. Hello, can you hear me well?
Yes, we can hear you loud and clear.
All right. To start on the aspect of recommendations, I think there is need of having a disaster preparedness mechanism, because the findings shows that there was lack of continuity and disruption of malaria programs that could cause malaria crisis and potentially reversing the gains towards malaria control elimination. This is more like a recommendation to us all, looking at the aspect of the pandemics that can as well come while we are trying to fight malaria. So there is always need of having disaster preparedness mechanisms that can help us so that we won't go back to those high cases of malaria where people will be dying, and a lot as we witnessed this in the lockdown and the COVID era, especially in Zimbabwe. And to add on, I think it is necessary for us as Malaria Youth Army champions to start at community level. I've seen a lot of people asking about what are we going to be doing and about the plan, etc. I think it's important that we start at community level, get to understand what is happening in your community in relation to malaria. What is it that people are doing? What are the small steps that they are taking? Where is it where people are donating things? Are there nets available? And getting to understand even the data that is available in your country and what is being done, especially at community level. That will help us so that we can actually achieve things even at national level. And also being part of educating the community and carrying out even clean out campaigns that can be done in high risk areas. This can also work as a way of educating and bringing capacity buildings to the community that is at high risk of actually getting malaria and dying from malaria. I think it's also important installing window nets and door nets to limit the amount of mosquitoes that will come, especially for Zimbabwe from the period of October to around April, since this is the raining season and most likely it will be a breeding period for mosquitoes. And for us as youth, it is also important to go the digital way. Let's talk more about malaria using different platforms. It could be podcasts, it could be radio sessions, a lot of things that are happening. Let's utilize the media as youth that are trained and that know a lot of malaria issues, and let's ensure that the message is actually getting to everyone in our countries and in the areas that we can actually reach out. Open more of even Zoom sessions, Facebook Lives that are talking about malaria, empowering people about the symptoms and a lot of things. Because I noticed in Zimbabwe, malaria is not one of the diseases that is usually talked about. Like it's not talked that much about. So in the period or in the era where we were in the lockdown, COVID and malaria have almost the same, or should I say some of the symptoms are the same. So it's necessary to actually empower people so that they won't really think it's COVID, or they won't really say it's another disease, yet it's malaria. And I think this is the reason why we had some cases rising in relation to that. And also let's invest in capacity building, just like what somebody said. It's really important to be empowered and to actually learn more. I understand we have a platform where we can actually get to understand more about malaria, the scorecards, whatever it is, the data. Let's analyze the data, and this will help us to actually be empowered and be resilient enough to actually tackle this disease and eliminate malaria. Let's also research more, getting to understand the data and being out there to really learn more, and this will actually help us. Thank you.
Thank you very much for those very solid points. In relation to your point on the scorecard, I see the link has been shared with us in the chat box. So please feel free to follow the link and learn more about the scorecard. I'm also seeing some comments and questions directed at the ALMA Youth Advisory Council. And most of us want to know how to get in contact with us or have some questions for us. Please feel free to share an email with us at iac@alma2030.org. The email address is in the chat box. Please feel free to send us an email and we would respond to it accordingly. I would like to move to, okay, there's a final question by Maria. And I believe the question has been responded to by Dr. Apat. This session is being recorded and it would be shared with us. So you can kindly go back to the discussions that we had earlier, or the sessions that we had earlier, and use this recording as a resource for your fight, for the fight in ending malaria. So thank you, and I would like to move to the final speaker, our final young leader, in the person of Alexis Kambambi. Monsieur Alexis Kambambi est le président national de DRC Malaria Youth Army Champions, et il va nous donner ses recommandations. Monsieur Kambambi, à toi la parole.
Merci beaucoup, madame. Vous m'entendez?
Oui, très bien.
Merci beaucoup. C'est M. Alexis Alisson Kabambi, président national de l'armée des jeunes champions de lutte contre le paludisme en RDC. J'interviens pour saluer les membres d'ALMA et particulièrement tous les membres du conseil consultatif des jeunes d'ALMA et les autres panélistes qui ont intervenu avant moi. En fait, mes recommandations, comme je ne saurais pas être trop large, vont se focaliser sur quelques points. Notamment parce que nous, déjà dans notre pays, en République démocratique du Congo, nous avons une coordination qui est active, qui est reconnue par le Programme national de lutte contre le paludisme, le PNLP, dont moi-même ainsi que quelques autres membres de la coordination. Au mois de février, nous étions au bureau du PNLP avec toute l'équipe du PNLP pour la RDC. Et lorsque nous avions été formés en novembre par ALMA, nous étions juste à 20 ou 25 personnes qui étaient formées ou 25 jeunes. Mais déjà avec mes efforts et mon équipe, nous sommes déjà des 40 jeunes qui sont en train de suivre les cours qui sont orientés par moi et l'équipe et qui ont déjà obtenu les certificats qui désormais forment déjà l'équipe de l'armée des jeunes champions de lutte contre le paludisme en RDC. Mais dans tout ce que nous avions déjà fait comme effort, il s'est avéré qu'il y ait quelque chose que nous allons souligner ici présent. Et donc là, voici quelques mes recommandations pour que l'armée des jeunes champions de lutte contre le paludisme dans chaque pays puisse très bien fonctionner. Selon les dernières observations que nous avions faites, il faudra que ALMA, à chaque fois qu'ils organisent une activité dont ils invitent tous les dirigeants du PNLP, selon les pays, puissent aussi réserver une invitation au coordonnateur ou au point focal de l'armée des jeunes champions de lutte contre le paludisme dans chaque pays. Pourquoi nous disons cela? Cela va permettre de faciliter l'intégration des jeunes dans la lutte contre le paludisme, dans des campagnes ainsi que dans des distributions de moustiquaires. Et cela permettra à ce que les jeunes qui sont en contact avec tous les autres jeunes et qui forment plus de 70% de la population africaine puissent activement contribuer à la lutte contre le paludisme. Et il faudra aussi que ALMA puisse doter les outils technologiques et informatiques à la lutte contre le paludisme afin de développer les stratégies innovantes qui pourront toucher plus d'une personne à connaître c'est quoi le paludisme et la manière dont on doit lutter contre le paludisme. Hormis cela, nous demanderons aussi, comme dans notre pays par exemple, nous avons déjà élaboré un plan d'action de lutte contre le paludisme sur lequel nous sommes en train de travailler. Nous demanderons qu'ALMA, dans ce qu'ils perçoivent comme, dans tout ce qu'ils mobilisent comme fonds pour lutter contre le paludisme, de communiquer directement avec les armées nationales des jeunes de lutte contre le paludisme de tout pays confondus de l'Afrique, afin d'être techniquement et financièrement appuyés pour mettre en place leur plan d'action afin d'éradiquer les paludismes. Et voilà un peu quelques petites recommandations que nous on avait. Et comme je ne saurais pas être vraiment trop large, et une fois de plus, je remercie tous les panélistes et surtout notre secrétaire exécutif, Madame Joy Mfampi, ainsi que notre président du Conseil consultatif des jeunes d'ALMA. Merci, Madame.
Merci beaucoup, Monsieur Alexis, et merci beaucoup pour vos recommandations. I would like to quickly call on Dr. Musonda to give us his reflections and respond to a few questions from the Zambia Malaria Youth Army team. Dr. Musonda, the floor is yours. Okay, as he's getting ready to join us, I would like to call on Albert to give us his reflections. Albert, you have the floor. Okay, I believe I'm not able to see them. So whilst they are getting ready, I would like to call on Dr. Irene to respond to the questions posed by the Zambia Malaria Youth Army champions. Dr. Irene, if you're with us, the floor is yours. Okay, Petrita, can you help me out? I don't see them. I don't know if it's.
Yeah, thank you so much, Patricia. I'm trying to.
Maybe just to read out the question, Eunice, from Albert, that I think as Dr. Irene is getting ready to respond to it. So the question is around, Albert is a member of the youth organization named Young People for Positive Change, and where he serves as a Secretary General, but also would like to know how can the Zambia young people per se, including himself, through the youth organization that he's leading, be part of the youth army, and what is the procedure for them in order to also get donor funding. So I'm not sure what donor funding is per se, but Albert has also unmuted himself, so maybe he can clarify a bit. Albert, please do speak.
Albert, you have been unmuted. You have the floor. Please kindly share your question with us. Albert?
Okay, thank you so much. Sorry, I was unable to unmute. Regarding the question of Albert, who is asking about the organization of Young People for Positive Change, where he serves as secretary. He's asking how they can partake in the fight against malaria and the organization. So I can tell him that in Zambia, they are also launching the National Malaria Youth Army with this upcoming World Malaria Day. So what we can do is just to link him with the team working with Zambia Youth Army, so that he can join and see how he can contribute. So Zambia has a very active team on working towards malaria elimination in collaboration with the National Malaria Control Program and the End Malaria Council in Zambia. The lead is called Mr. Justin. If he can collect information about how the National Malaria Army is working in Zambia, and also if he can follow all the Malaria Day celebration in Zambia, he can get more information. So we'll give him the contacts where he can try to reach out those members. Thank you.
Thank you very much, Dr. Irene. I believe the question has been responded to. The links and the contact details will be shared in the chat function. So thank you to our young leaders who shared their recommendations. Thank you once again to our panelists. Thank you everyone for joining. All too soon we have to draw the curtains on this event. But before we do that, I would like to call Ambassador Antonio Cara, who is ALMA's special ambassador, to share with us his closing remarks. Ambassador Okara, you're welcome and you have the floor.
Thank you. Thank you, Eunice, and thank you everyone for this really wonderful session that we had this afternoon. A lot has been said about energy of the youth and so on. I noticed in the first 10 or so minutes, we had well over 100 comments. And maybe I've been attending the wrong kind of Zoom sessions. Normally, when you have a Zoom session like this, you don't have 30, but the speed at which the comments were coming in, just making us aware of your presence, where you're from, you're getting the feeling that it's from across the continent, from Nigeria, from Zambia, from everywhere. You know, that's exactly what I think is referred to by the energy of the youth. And if you bring that kind of energy and channel it into the war on malaria, you definitely have a different dimension to it, and it's more sustained. So first and foremost, I would like to express our appreciation to all the speakers and panelists that have addressed us today. Roy, your colleague that spoke on your behalf, Yassine, Donald, Vivian, Brian, Otina, and Alexi, for all the great comments, contributions, ideas that you have shared today, as well as all the questions that were raised, allowing us the opportunity to further elaborate our thoughts on this important subject. And these have all provided a very valuable contribution to this roundtable, that marks this year's World Malaria Day. As you know, this day is an occasion to highlight the need for continued investment and sustained political commitment for malaria prevention and control. In that context, sessions such as this one are very critical to marking a day like World Malaria Day. To me, and I'm sure to many of my colleagues, this session has been very successful. And I would like to congratulate all the young people for keeping the culture of organizing the series of online sessions and conversations on malaria elimination, which are instrumental to keep the malaria in their agenda, as well as their efforts to contribute to the journey towards eliminating malaria by 2030. As indicated, one of the purposes of this day is to sustain political commitment. And when you look at the level of participation, at the type of conversations, the level of engagement that you all bring on board, the voice that you create cannot be ignored. And it is critical in ensuring that political commitment remains alive. And as you do that, we at our levels will continue to support and provide a vehicle through which that voice and energy can be channeled. This year's World Malaria Day commemoration is an opportunity for all stakeholders to reaffirm the importance of putting young people at the center and the power that the young people are bringing on board to a robust response in the fight against malaria, including harnessing real-time data to scale up and optimize tools for malaria elimination. And maybe for the purpose of the panelists, we are not just throwing in words. I think someone mentioned earlier, one of the panelists, that we should be careful not to use data words in a manner that just enhances the narrative. We are clearly are committed to having these tools available in a manner that can be useful. As I conclude, let me take this opportunity to commend the ALMA Secretariat, the ALMA Youth Advisory Council, the Malaria Youth Armies, and the Youth Champions, as well as everyone who joined us today, but also encourage you to keep the momentum going as we work together to promote the important role of multi-sectoral partnerships in achieving significant strides towards the shared goal of malaria elimination. As we've always said, zero malaria starts with me and with all of you. Thank you very much, and I wish you success going forward. Asanteni sana.
Thank you very much, Ambassador Okara. Thank you for those closing remarks. I would like to thank everyone for joining us today. I thank the Secretariat for hosting this amazing session, and also thank my colleagues at the Youth Advisory Council for being part of this initiative. Merci beaucoup tout le monde et bonne journée à vous tous. Au revoir.